Immunotherapy is certainly an exciting area in cancer in general across many tumor types, and kidney actually is one of the tumor types in which immunotherapy has worked in the past. And as Dr. Atkins pointed out in that session, is kind of coming full circle and now working again. So right now, none of the newer immunotherapeutic agents are yet approved in kidney cancer, although we expect them to be shortly. So I think for the community oncologist, keep your ears to the ground and your eyes peeled. I know there's no community oncologist out there that hasn't heard about these agents in melanoma, lung cancer, kidney cancer. One is now approved in the US for melanoma, but more are coming. So I think we need to watch the data as it emerges, critically evaluate it, and kind of be ready for these to enter the clinic in the next several years. There's sort of two parts to that. One is why, and one is just the observation that they work. And I think, on the scientific side, there's been a lot of amazing scientific work done developing these agents, not only figuring out why they work, but finding even the next generation of immunotherapeutics that might work even better, combining them. So a lot of credit has to be given to the scientists that do that. But really, as a clinician, we care a lot about whether they work, not so much the mechanism. And I think part of what I talked about in my talk is that some of what we do is based strictly on science, and some of what we do is a little bit empiric based on what we see the effects of these drugs being in the clinic. And so I talked about combination immunotherapeutics and tyrosine kinase inhibitors, or VEGF targeted therapies in kidney cancer. Again, there's some clinical trial data. There are more trials ongoing. We really just have to wait to see the data. But combining these two, they both work. They seem to work well together. We'll be looking closely at those results. I'm impressed at how well the companies have been working together. So for one trial that I'm involved in and another that colleagues of mine are involved in, GSK, for instance, is working with Merck to combine pembrolizumab with pazopanib. That would have been unheard of maybe a few years ago, but that kind of collaboration is exactly what we need, and we welcome it. Same with Pfizer has axitinib and is combining with pembrolizumab with Merck, and they're really working together really well to do this. So hopefully, actually, we'll prove that two companies with two drugs where it makes sense to combine them can work together and ultimately come up with a better therapy.